Georgia schools manage a wide range of K-12 needs, from student anxiety to crisis intervention. These factors place constant, invisible pressure on the school environment. Even when licensed therapists are available and students are in need, the system often fails to bring them together. The two groups remain isolated, with no functional bridge to facilitate care. This disconnect leads to measurable consequences in the classroom. When mental health needs go unaddressed, student attendance drops, and unresolved behavioral issues begin to affect the learning environment. The core of this crisis is systemic friction. The supply of care exists, and the demand is high, but the infrastructure to connect them is missing. Families frequently cite the same hurdle when considering mental health care, the assumption that they simply cannot afford the bill. This visualization shows why. The traditional cost of private therapy often takes up a significant portion of a household's discretionary budget, making it appear out of reach for many Georgia families. This raises a question for school districts. What happens to the school ecosystem if this financial barrier is removed? For many, the anxiety regarding a potential bill prevents the conversation about care from ever starting. MentalSpace School functions as a specialized routing infrastructure. It is designed specifically to bypass the common points of friction found in healthcare billing. If a family has Georgia Medicaid, MentalSpace routes the billing so out-of-pocket costs are $0. This includes Peach State, CareSource, and Amerigroup. Commercial plans like Blue Cross Blue Shield, Cigna, Aetna, UnitedHealthcare, or Humana route directly to standard, low copay outcomes. By utilizing existing state and private insurance structures more efficiently, the system removes the financial friction that prevents families from seeking support. Once the financial hurdle is gone, the next step is delivering care without disrupting the student's education or the parent's workday. MentalSpace provides dedicated, culturally competent therapist teams who work directly with the school to offer same-day teletherapy sessions. This teletherapy takes place over a secure network nested within the school building. The entire infrastructure is built to be strictly HIPAA and FERPA compliant. Integrating care into the school day removes secondary barriers like navigating transportation, sitting on wait lists, and complex scheduling. For school administrators, this infrastructure also addresses a looming administrative deadline. Georgia public schools are currently moving toward a July 2026 deadline for state compliance under the requirements of HB 268. Implementing MentalSpace allows a district to satisfy these legal mandates immediately using a plug-and-play system. This approach allows a district to solve for systemic legal compliance while simultaneously addressing the individual needs of their families. When the infrastructure is in place to facilitate regular, ongoing sessions with a dedicated therapist, the results begin to show in the school's data. Schools using this system have seen an 89% improvement in student attendance, as consistent care helps students return to the classroom. Alongside higher attendance, the clinical data shows a 92% reduction in student anxiety levels following regular sessions with their assigned therapists. This stability is reflected in the community as well, with an 85% satisfaction rate among families regarding the care their children receive. These metrics are a direct result of removing the financial and logistical blocks that previously kept students and therapists apart. We are moving past the idea that mental health support for a child is a luxury for those who can pay out of pocket. Accessible mental health care is a foundational pillar of student health and a requirement for a high-functioning school. School administrators and families can learn how to integrate these services by visiting MentalSpaceSchool.com or contacting the team at MentalSpaceSchool@chctherapy.com. When we treat mental health as standard healthcare, the entire education system is better positioned to thrive.